Welcome back to the studios of HALA Kuwait, dear viewers, as we begin our first phone call interview this evening. We are joined by Kat Skomorowska, whom is a physiotherapist, joining us through the phone to talk more about the manual lymphatic drainage, or the lymphatic system, one of the most important systems in our bodies. Hello, Kat, are you with us?
Hey, hello, how are you?
I'm doing very well. How are you doing, Kat? And of course, thank you for joining us.
Thank you for the invitation. It's a pleasure.
Likewise, Kat, now the lymphatic system. So I've studied this back in high school in biology, and it almost took me by surprise because we know the circulatory system, we know the respiratory system, but the lymphatic system is interesting because it combines the blood circulation and the drainage of excess blood left in the tissues with helping our immune system and almost leading the way against infections. So just from your perspective, as someone who works in the field, especially with lymphatic drainage, tell us, what is it exactly, the lymphatic system or the lymphedema?
So you started very well, but most of the people, as they're not very interested in the medical terms and understanding all these terms and the situation. So I usually explain that the lymph, it's mostly named by the water that we have in the body. Mm-hmm. So it is kind of water. It's like a fluid, as you mentioned before. It's one of the fluids, like blood circulated in our body. It's since we are born, it's there, it's working, and it's helping.
All right.
The lymphatic system, it's like half of the circle. It's not the full circle like a venous system.
Okay.
Yeah. So it's the point. The very important thing here is that lymphatic system joins the venous system to make the full circle in our body. Mm-hmm. So if one is not working well, the other can also be disturbed.
Okay. And they work together.
Yes, exactly. But still, lymphatic system has its own vessels to collect the lymph from the tissues and to push it further. Mm-hmm. And in the meantime, there are also the nodes in the
lymph nodes are just around different points around the body.
Yes, exactly. They are in certain areas of the body, which is also very important. And we have some organs also connected to the lymphatic system. So it's all, it can work separately, but in the end, it's still working with venous system, circulates around our body and collects all the proteins and like a kind of leftovers that are between the tissues.
Yeah, that's
it's
wonderful.
Very important in the immune system as well.
I think that's really mind-blowing because there's blood that seeps through, obviously, from the capillaries, providing the muscles with the oxygen for respiration to happen, and metabolism and all that to happen. But then some blood is left over in the tissues, and that's the role of the lymphatic system, to just get rid of everything and make everything clean.
Yes.
Now, Kat,
exactly.
So sometimes there's swelling, and we've seen that in the photos that were just on the screen. Now, is this swelling of the lymph nodes of the lymphatic system, and is that what is called as lymphedema? Or is it necessary to be lymphedema?
So not every swelling is lymphedema. We need to understand that. The general term called edema, which is the most common the term for swelling. It's sometimes it's a natural situation that happens in our body after any injury, infection, or some inflammation ongoing. But lymphedema is a specific term related to when the lymphatic system is not working properly. So there is like a let's say
a blockage almost.
Blockage or damage to the part of the lymphatic system, like after removal of the nodes or the vessels of the lymphatic system. They have valves, and sometimes the valves, with the time, they might gain the insufficiency. So if they're not working correctly, so the lymph is collected in one place, then we might talk about lymphedema. But as I mentioned before, not every swelling, it will be an lymphedema.
Some of it, as you mentioned, is called just edema.
Yes, exactly.
Right, Kat, and just the idea of swelling really is unfortunate. No one wants to get that, and that's where you come in with your work. But then, Kat, let's also, before we talk about the treatment, look at how lymphedema is connected with cancer, if there is a connection at all. Can you help clarify that for us?
Yeah, so when we are going through the operation related to the cancer, the doctors might decide to remove nodes. As we mentioned before, lymphatic system responsible for the collecting all kind of leftovers, which include the cancer cells.
Okay.
So the lymph might shift it to the nodes, which is like a filtration station. So this will be the point where the cancer cells might collect.
Collect and spread.
Spread, exactly. So it's up to the doctors, of course, not to anyone, to decide rather to remove them or also how many of the nodes are supposed to be removed.
That makes sense.
So now imagine the situation that, so we fighting with the cancer is removed, but with the cancer it's also removed part of the lymphatic system, the kind of important part.
Right.
So then the whole system is impaired and it's not working with the full capacity.
Right. All right. Well, that sounds rather interesting, Kat, and we'd love to hear more. We will continue our conversation for this evening about the lymphatic system, but you'll have to excuse us as we go to a quick break, dear viewers, for the call to prayer, and then we'll resume after that. Welcome back to the studios of HALA Kuwait once again, dear viewers, as we continue our phone call interview with the physiotherapist Kat Skomorowska. Now, Kat is specialized in manual lymphatic drainage with the lymphatic system as our topic for this evening. We continue our discussion with her. Hello, Kat.
Hi, hello, Rania. How are you?
Well, again, and I hope you're great as we continue this discussion. Now, Kat, we were just talking about the connection between the lymphatic system and cancer, how the cancer cells can be collected and then spread around the body. Now, of course, with that, you've mentioned that we need to look for symptoms, or what should we be paying attention to before we head to a doctor?
As I mentioned before, not every swelling is lymphedema. Some swelling is the natural reaction of our body. Let's say if we have injury, just we hit something and our body can get swollen, the certain area. Sometimes it's just enough if we're going to do the prevention of the, manage the situation with the injury, so like elevation, rest, and in few days, we're talking about like 2-3 days. Mostly, it's supposed to be fine.
Okay.
Eventually, so the warning sign, if it's going to be extended, like especially over a week, that might be a worrying situation. If we have some medical intervention, like an operation or something, again, that will be totally natural process, because again, the lymphatic system is it's included in healing processes, so there might be swelling. But in that case, MLD, so manual lymphatic drainage, it might be helpful to just speed up the process. So it's not a major treatment. It's just kind of like a support.
Right. So what is it do you do, Kat, then, in that case, especially when the body is swelling around the lymphatic system? How do you approach that? Especially now, looking on the screen, we were just showing photos of you working with your patients, treating their swelling. So how do you approach that?
Okay, so there is manual lymphatic drainage as a main part. It's a hands-on treatment, which it's about to support the drainage of the lymph.
Right.
So with the certain movement of my hands, the idea is basically to push the lymph from the places that it's the swollenness is occurred, to just push it to the nodes.
Okay, almost supporting the natural process of the body.
Exactly.
Right.
But some of the pictures also shows the parts of the components of the CDT, which is complete decongestive therapy.
Okay.
Complete decongestive therapy includes not only MLD, it's the main part, but also there is multi-layer bandaging that you saw in the pictures. Also compression garments and skincare and exercises as a whole process of getting back to
normal. It does sound
kind of
like a full integrated system that is necessary to help treat swelling, which is your area of expertise. Now, Kat, tell us, over the years as you've practiced manual lymphatic drainage, does this happen more often in the elderly? Does it happen in young people sometimes, more common maybe in men, women? Just what age group or what societal group is most at risk, could you say?
Well, this is the difficult part now, because it can be related to everyone. Especially that cancer can affect any of us in any age.
Okay.
So this is something that that is one of the main reasons, as we talked before, about the lymphedema and the cancer.
Okay.
But also, as we said, it's connected with venous system. So the veins are not that strong anymore with aging processes. So yes, of course, the elderly people might have more issues, especially with lower limbs, so legs. That might be, elderly people. But generally, as I said, I saw the people from very
diverse backgrounds and communities.
Especially because there are some conditions, which maybe it's worth also to mention. As I said, lymphatic system is from the beginning, from the birth. So unfortunately, it might be affected from the childhood as well.
I see. So you mean here that it's genetic sometimes?
Could be. Yes.
I see.
Unfortunately, could be genetic, could be the group of the rare disease that affect lymphatics from the birth.
I see.
So seeing kids also, it's possible.
Right. And Kat, I know we've briefly mentioned this, but it would be great to cover it once again. Just really, what can we do to prevent lymphedema, edema, or just blockage or swelling of the lymphatic system? Because obviously that swelling looks very painful. No one wants to be a victim of that, but just what can we do on a day-to-day level to help prevent that, especially if someone is leading a more active lifestyle? I believe with more movement, maybe that can cause swelling to happen at a higher chance, or just clarify that for us, please.
Well, with more movement, it's also a tricky situation, because if you run a marathon, you also might get swollen legs after marathon, because there's an extended work.
Right. Too much pressure on the body.
Exactly. So also getting MLD that time, it's like part of the recovery phase for the sports people. But generally, it's well known that deep breathing with your diaphragm, it supports the flow of the lymph. So this is kind of something that we can do on the daily basis, even if we don't have any issues, but just deep breathing with the with diaphragm, and we should always react fast if we see anything that makes us worrying. That, as I mentioned before, swelling that it's staying over a week and it's not getting any better, especially that swelling that it's not, it doesn't respond to any elevation. And by elevation I mean
just lifting that body part a little bit higher up.
Above the heart level.
Okay.
So when it's lower, if it's leg, we're supposed to lay down and make it like put it somewhere higher than our heart level. When it's arm, just keeping it a bit higher, like above the heart level again.
All right.
So it's not only lifting it up from the floor, which unfortunately very often happens.
But then, Kat, just excuse me, for the elevation sort of approach, just if someone's trying to calm down swelling, how often should they do that for? How often should they do it, and for how long?
Well, if we have just, we see that on the daily basis. We're getting swollen legs after a whole day, for example, standing at work. Then every evening we're supposed to do it, and the best it's I would say minimum 20 to 30 minutes.
20 to 30 minutes.
Lymph, it's moving very slow.
Okay. Should they combine it with any sort of movement or just the elevation in itself?
Well, I don't want to worry anyone, but if the elevation is not helping and so the support of the gravity doesn't help, means that we already have some issue with the lymphatic system.
All right, so just the elevation, no exercise whatsoever to accompany that?
More movement, with more, if the muscle is going to move, they create like a muscle pump that also supports lymphatic system. So any exercises basically are helpful.
Wonderful. Does maybe aquatic exercises, you know, given that they provide more support in a way, helping you float in the water, are they maybe safer to do if you're having any lymphatic system problems?
There are researches about the help of the aquatic exercises, but then we need to also be aware that under the water, the water creates compression, like a pressure, which gives us compression, yes.
Even though, Kat, one would think that someone with the joint issues, the back pain, they're always recommended to, you know, jump into a swimming pool and exercise there.
Yes, because the water gives you freedom, and also it's very good for the lymphatic as well. But then we would need to say at which depth, because just going to the pool, it might be not enough.
All right. That makes sense. And obviously, it's very important to just work hand in hand with an expert, such as yourself, a physiotherapist who is really well known when it comes to the lymphatic manual drainage. Now, Kat, tell us more about the process of treatment. Let's say an individual comes in with very severe swelling. How do you approach that? Just what kind of treatment plan do you put in place for them?
Well, so first of all, the diagnosis of the lymphatic system is very limited, and it requires very specialized doctors. So usually it's more about, as a therapist, I can say it's more about the observation and documentation based on the girth. So I start always with the investigation, what was the start, if there was any point in the past that it could lead to the current situation and how it changed through the time. And then we're doing the measurements because sometimes it can be only one part of the body, and sometimes it's both sides. So
both sides, so it's just double or multiple swelling areas.
Exactly. So sometimes, or it might be even on the trunk. So it's then the girth, taking the girth, it might
Kat,
be difficult.
Did you say the tongue? If I heard you correctly.
Trunk. Sorry, the abdominal part.
Okay.
Well, the tongue will be more when it's coming to the neck. Happens sometimes. I'm not saying no. But
anything is possible. Like the body is a very interesting, fragile system.
That's true. So yeah, that's basically then after the investigation, and of course we need to clarify a few situations, and if there is any problem with the heart or the venous system, that needs also the clarification. Eventually, the sugar issue. If we're talking about the diabetes. and then I can eventually start the treatment. And the treatment itself should not give any pain. Pain, even I would say that is an indication that there is something wrong happening, like cancer or something, unfortunately. So then more medical checkups would be required.
All right. Sounds very good.
Hopefully not.
Well, no, it sounds good. You actually relieved us and you shared a lot of information with us this evening, Kat.
Yeah. Well, I just want to make sure that people always can, it's internet is full of information, but not all of them they are true or make you calm.
True or updated or just relevant to that specific case.
Exactly.
A lot of misdiagnosis happens.
Exactly, and every case it's supposed to be, looked individually, and then it might vary from one person to another. So I always want to make sure that people feel comfortable and they got all the knowledge and information from me, to feel secured and that they know what to do. Because sometimes I might see them like twice or three times, and then they will manage the swelling, the lymphatic issue by themselves.
Right.
Sometimes it's just a bit of education, management, and the guidelines what to do, and then they're fine to go to live their life again.
Exactly. Well, Kat, you've definitely gotten us a few steps closer to having enough knowledge when it comes to this for just the layman. And of course, we always encourage all our viewers to seek medical supervision and guidance if they're facing any problems. Thank you so much for joining us, Kat.
Thank you so much for hosting me. And once again, if anyone is confused or have any doubts or would like to just consult the situation, we are at Fawzia Sultan, happy to help anytime.
Thank you so much, Kat. We really appreciate it. So, dear viewers, with that, we have come to the end of our discussion on the lymphatic system with the physiotherapist, Kat Skomorowska, which is a very important topic, especially given that the lymphatic system is involved both in the circulatory as well as our immune system. So please take good care of yourselves, especially